Sometimes it feels like the sun will never rise, like the birds will never sing again. Believe in a power greater than what you are going through. When you don't know what to do, keep breathing.
That's right. When you don't know what to do, just keep on breathing. From Los Angeles, the City of Angels, I'm Dave Nassani, Caregiver Dave at caregiverdave.com. And I usually have my lovely co-host Adrienne Gruberg from the caregiverspace.org, but she is unable to make it today, so I am solo. And we're coming to you live and on demand 24/7 on numerous syndicated radio and podcast networks on 26 global audio and video platforms. Platforms like iHeartRadio, iTunes, YouTube, Spreaker, SoundCloud, Vimeo, Stitcher Radio, Blog Talk Radio, CastBox, Mixcloud, and about 16 others. And we're very proud to be voted number one caregiver podcast of the top 50 on Player FM and number two caregiver podcast on FeedSpot out of the top 60, as well as number two caregiver podcast on caringvillage.com. And we have an especially exciting show planned for you today. Dr. Yon Bon-hoffer, and he is a global expert on infectious diseases and vaccine safety and a thought leader on efforts to transform how medical professionals care for their patients and themselves. And his new book, Dare to Care, How to Survive and Thrive in Today's Medical World, is selling like hotcakes, I would presume, because this is a topic that everybody's talking about and that nobody can agree on. But before we get to the show, I just want to take this moment and thank last week's guest, Lindy Lewis, Progress Not Perfection. She's a recovering, authentic alpha female who, through sharing her humbling blocks and pivotal collection of tips and tools to live an empowered and full-color life. And just a reminder, you can watch or listen to that interview and all our interviews on all our membership websites and caregiverdave.com and the 26 global networks that I mentioned, as well as the show we're doing today right now. All right, enough of that. Author of Dare to Care, How to Survive and Thrive Today, Dr. Yon Bon-hoffer, Welcome to the show. We're so excited to have you on.
Thank you, Dave. Thank you. It's a pleasure to be with you.
And I always like to ask my guests the first question, just who is Dr. Yon Bon-hoffer and why was he placed on this earth?
Thank you. Well, it feels
coming
like
all
grace.
The way from Switzerland.
Yeah, it feels like grace. It feels, well, who am I to know why? But the one aware of living is experiencing deep gratefulness of being allowed to spend time on this marvelous planet.
That's a great answer. Forgiveness keeps a lot of bad things away, doesn't it? They say that cancer and ulcers and just internalizing all sorts of things, I like to say unforgiveness is like drinking poison and hoping the other person will die. Do you agree?
Oh, yes. There's an infection.
As a former consultant to the World Health Organization and the CDC, who led a global vaccine safety initiative, what questions do you think we should be asking about the new COVID-19 vaccines? We're so honored to have you here speaking about this subject. I've had Dr. Mark Siegel on from Fox News. He's a Fox News contributor. And it was a very good show, and he was enlightening us on all sorts of things that we don't normally hear in the media. And in today's media, boy, if you disagree with anything, they'll just cut you off. They'll cancel you. They'll just it's called cancel culture, I think. America used to be a place where we debated, and that's how you come to the truth. You debate your side, and let him debate his side, and then we can decide what makes sense, and we can follow. We want to follow the science, don't we? So go ahead and tell us what questions you think we should be asking.
Well, thank you. I think this is a really important point you're making, is that actually most advances in medicine have been made at the outliers, have been made by people who were willing to live courageously and stand by their insights, and typically were ridiculed at the time of putting their opinions forward. Think about the current state-of-the-art treatment of heart failure. Think about heart attacks. Think about a lot of what we know today as treatments.
Infections. They
Infection.
laughed at everything. They mocked and ridiculed everything. And some things, the more things change, the more they stay the same, don't they? Now you're mocked if you consider a drug to combat COVID-19.
Yeah. I think one of the key questions to ask is why did we start the immunization campaign? And I guess the key aim of this campaign was to see that we have ICU units stay reasonably packed and not overcrowded, so we're ending in ethical dilemmas that nobody wants to be in. And we want to see that the hospitals can actually serve everybody in a meaningful way. So overcrowding was really one of the key attempts, and this has kind of shifted a little bit during the campaign now. So particularly when we're now moving to adolescents and children, as a pediatrician and a pediatric infectious disease person, I'm a little bit more cautious than the current law. So I'm not quite sure if this is really the right way forward, that we're immunizing those who are clearly not suffering as much as those that are identified risk groups. And we don't really have the safety data together right now. So,
well, I can think of questions right off the bat. Number one, in the past, didn't we quarantine and isolate those who were sick as opposed to quarantining and isolating those who are well? It seems like we're doing it backwards.
Yeah, and to some degree, we are in a quite unprecedented situation. Aware of that, really, there is a global infectious disease spreading in the way that it does, and we're faced with the kind of helplessness that we're observing, and that is kind of smudged over by strong opinions. So it would be, I feel, the scientific approach that you lauded. It would really help us. So the open-mindedness of a PhD helps more than the opinionatedness of a politician.
Yes. You say that we're facing a pandemic of fear, quote unquote, and that it is potentially longer lasting and more damaging than COVID-19 itself. Would you please explain that?
Yeah, it's very evident. When we see in how we actually moved into this pandemic, a lot of our actions were driven by fear, were driven by helplessness and an urge to act. And we're now seeing the consequences. So when I see now, for example, as a primary care pediatrician in Switzerland, a comparatively affluent country, I see so much suffering now of people who are families who are now really taking the consequences and have to live the consequences of how we handled this pandemic. In many ways, we're learning that the steps we have taken might not have been the wisest. Mm-hmm. And I hope that there's a learning that acting in a fear-driven way is something that we're very used to in the way that Western medicine works. We're trying to get rid of disease, and there's a completely different mindset available, and maybe a heart set available. It's not so much fighting disease, but actually promoting health. And I wonder what it might look like, what might be different if we're approaching a pandemic from this point of view.
People are wondering, I'm sure, who you are and what you know and what makes you an authority on this topic. Why don't you give a brief resume of why you should be even talking about this. How do you know what you know, and why we should listen to you? There are so many voices out there.
Well,
And why YouTube hasn't censored you yet.
Well, nobody should listen. So what my background is that I'm a professor of pediatrics at the University of Basel, and my specialty is in vaccines. And I worked for 20 years in a global network of vaccine safety specialists. And our aim was really to conduct and to promote independent, rigorous science in the field, to see that we get beyond the opinions and beyond the fear on both sides, pro and con, and really just see, can we clarify the questions at hand? And so in this effort, I was honored to work with the CDC and the World Health Organization and the European CDC, other kind of national authorities in developing and advising global immunization programs and developing safety monitoring systems. So this has been my profession for the last 25 years.
That's pretty impressive. How does Switzerland and the United States differ and are similar in how they handled COVID-19?
Oh, that's a big topic.
Take your time.
Well, I guess we're looking at very different cultures. We're looking at very different populations, very different needs.
That's an interesting comment. How would you? Because I've met people from Switzerland. They seem like normal people. They almost seem like Americans, except for their accent. How are Americans and Swiss different when you say different cultures? Let's start with that.
Is there an American? Like, what is an American?
Is there an American culture? I don't know. The rest of the world would have to answer that one.
I guess one of the beauties about this amazing country is the variety and the differences and actually learning and thriving on.
Which one are we talking about? The amazing country of Switzerland or the amazing country of America?
The U.S. I'd like to talk about U.S. Yeah. So there's the cultural differences while providing conflict and a source for conflict. It's an amazing resource to learn from each other and to grow in an incredibly creative way. And this is what we're observing from Switzerland. Is this very creative and inspiring and out of the box, if you like, deliberately non-traditional approach. And Switzerland, to some degree, is it appears, again, like who's a Swiss, but it appears more, traditional and more rooted in European culture and more kind of conservative and maybe, taking the second step first. And it doesn't mean that there's no innovation in Switzerland, but
sure.
I think there's a different kind of general culture. Yeah.
I get it. Okay, now that you've defined that, you were going to mention the difference between how the U.S. and Switzerland have approached COVID-19.
Yeah. What I perceived in Switzerland is that I felt it was approached quite masterfully given the uncertainties, and I felt that there was a lot of willingness to face and accept the uncertainties and go slow. And that was not to the liking of everybody. But in many ways, I felt it was a wise approach to not be quite extreme, not ignore what is at hand. So be, timely in the actions, but not kind of try and run ahead. And I have seen very little opinionatedness here, kind of overt opinionatedness. And this is something that probably has been part of the politics as far as it is, as far as it was observable from Switzerland.
Sure.
That is there, and that's when it's about being right and wrong, and when health becomes a political gameplay. This is painful to somebody who actually cares for patients.
So you talk about going slow. I assume you mean taking your time to find the vaccine, doing it like you've done all vaccines, 1, 2, 3, 4 years, trials, etc. Is that what you mean by going slow?
Yeah, in terms of due diligence, do the due diligence
Yeah.
before we're implementing measures like going on a lockdown in a country, before we implement measures like everybody needs to wear a mask, before we close all schools in the country, it might actually help us to collect data and see what we can do to actually support these actions.
Well, of course, they did it because infections were skyrocketing and getting out of control, according to them, whoever them is. And so, how do you collect data and take your time and be slow when it appears to be getting worse and worse? And masks, first they said that, well, don't wear a mask because it doesn't help anyway. A virus is smaller than the material. It'll just give you a false sense of security. And all of a sudden telling us you must wear masks. And it doesn't matter what kind of mask. You can wear a T-shirt. And I'm confused. Maybe you can straighten me out.
Yeah, it is confusing. And I guess this is part of this is why it is so important to communicate the current state of ignorance and accept it. So if we are actually saying we don't know, but we're looking at this question and this question and this question, and this is what the process is, this is maybe more helpful for a population to follow the learning process that everybody's going through. And I guess there is a need by those who need to sell stuff, and there's a need by those who want to be reelected to have a strong opinion. And that's understandable, but it's not the scientific approach.
So the death counts.
Yeah.
And now we have the privilege and the luxury of looking backward. If we did go slow, would less people have died than going fast with this vaccine? Because, it seems to be under control now. I don't know why it's under control. Is it under control because we vaccinated a third of the world or Americans? Or did it just automatically happen to be herd immunity? Or was it just destined to die anyway? Are there strains that are going to come back and haunt us? Which method would have translated into fewer deaths, the slow method or the method that apparently the U.S. took?
Yeah. I'm not sure there's a right answer here. So it would be the only illness, I guess, or the only condition that we're looking at that has one right solution. Typically, there are many contributing factors. And the vaccine is very clearly one of the ways or the vaccines are one approach to decreasing transmission and increasing immunity. We're far away from herd immunity. That would require some 80% or more to be immunized. So, but yes, we know from the first kind of post-licensure data that the vaccines are effective, and that with several of the leading vaccines that were rolled out early and that we have now the data from, are actually reducing, hospitalization by 70-80%, and that they're reducing the death rates and mortality rates. So, yes, we know they're effective. We also know about the safety right now, and it's quite encouraging so far. What we're seeing.
Are they safe?
Yeah, what we're seeing so far is quite encouraging. But we have to, what do we expect from such a vaccine? So, I guess when my risk dying of COVID is very high, I'm willing to take a higher risk on the safety side of a vaccine. I'm basically a healthy person and very unlikely to have any serious course of the disease. Then first do no harm is a very different meaning, and then I want a higher safety margin. And that's, I think, what hasn't fully been established yet. So that's what's happening right now.
So the stories that we hear about people getting tremors or getting sick or dying, that's a very, very tiny minority, and you still, even with that, it's going to happen no matter what. There's just certain people who, are intolerable to vaccines, period?
Well, I mean, we're still in the learning curve here, but certainly vaccines have side effects. There is no 100% safe vaccine. There's no 100% safe intervention, and there's always those, like on the Bell's curve. There's always those that are under responding, those that are over responding. And our question is, can we identify those who might be over or under responding, and who are the ones that really benefit from protection, and who are the ones where we want to be a little bit more prudent? And that's the learning process that's ongoing. And I think it's helpful to say at this point that we just don't really know yet. The data is still pending on the safety side. And
will we ever know?
Yeah, I think so. Yeah. And
how long do you think it will take before we know? Like 1 year, 5 years, 10 years?
Well, it's going in increments. So the first, I guess, up until kind of a frequency of 1 in 100,000, kind of a risk of having a serious adverse event, 1 in 100,000. That's the data aren't bad right now. This is pretty solid data coming up. Anything more rare than that, we just don't know, and it will take probably another 6 to 12 months to have better data.
But was the death rate really ever alarming? I mean, I'm talking about. I know in the beginning more people were dying because we didn't know what we were doing, and then there were some drugs that came out that were very helpful, according to some people, and. Was it a death rate that warranted shutdowns and masks and all of this? Because, people get infected. Sometimes there's bad flu years, and sometimes flus are really bad. Yeah. But and there's always a segment of elderly people who will die from the flu. I mean, the numbers were astounding 2 years ago, how many elderly people died from the flu. And the research I've done is that COVID never really reached the numbers of just the regular flu. And if that's true, because I can't get a straight answer from anybody, if that's true, then why is COVID different other than, politics? Yeah.
Well, there are many open questions on the field. To me, the COVID experience is a little bit like American football, and as little as I know, is that somehow there's a mess. And then once at some point that mess resolves, and then you have all these yellow flags on the field. And so right now there's a lot of yellow flags on the field, and I think the referees, the scientists need to actually go and check it out. Let's go through this and say, what happened here? What happened here? What happened here? There's a lot to resolve and a lot to learn. And these are extremely relevant questions. Yes.
Yeah. You talked about
what really concerns me. Sorry, go ahead.
Right. You go first.
What really concerns me is that a lot of caregivers. I mean, let me just express the deepest respect that I have, and there is the reason why is that quite often caregivers are actually providing and holding this space for healing, while medicine is kind of aiming at curing the condition. Caregiver is actually providing the safety, the security, a sense of being heard, a realm of relaxation, a realm of healing space. And there is arrogance quite often. Caregivers, I used to work as a caregiver to help me finance my studies many years back. So I well remember that arrogance from medical professionals about the caregivers. It's like, yeah, it's nice you're being nice to Granny, right? Sort of thing. And I'd like to ask for forgiveness here. Because what medical professionals are learning is to know in a situation of crisis. And that's not the openness to hear and to listen. And so in many ways, I wish that in medicine, whether it's about COVID or it's about other conditions, that those who have been trained in medical schools or other professional trainings would really benefit from learning from caregivers about what really matters to those who are suffering. And isn't it that what we're trying to prevent with immunization programs? Isn't it, after all, not numbers that we're treating, but really people? Isn't it,
Yeah.
after all, that it's about the suffering of individuals and not the numbers and the death rates and the statistics and the whatever?
Yeah, and I know a lot of teachers who claim to care about children, but yet they don't want to go back to work, and they're vaccinated, and they told us the vaccination will help, but now they're saying, well, you still need to wear a mask. Well, you still need to stay away from people. Well, you still can get it. Well, you still can give it to people. Oh my gosh, why are we getting vaccinated if? And the answer that I get is, well, we just don't know. Really, is that the best we can do?
Yeah. Well, this is part of this pandemic of fear. This is where it's completely going out of hand. So this is where, as a pediatrician, I see the effect in children, and I'm just deeply alarmed by what I see in 3 to 6 year old children who are in kindergarten and daycare, and what their reality is that they have a sense of, I am dangerous. I may actually kill my grandmother. Yeah? What an outset to start your life. Yeah? Oh my God.
That'll mess you up.
These consequences we will have to deal with in the next decades, probably.
Can I talk about vaccines just in general?
Sure.
There's anti-vaxxers out there, and there's those who think anti-vaxxers are endangering the rest of the population. Let's talk about children's vaccinations. I'm told that sometimes in the past that they were giving children as many as 5, 10, 15, 20 vaccinations at the same time. Is that wise? And some even believe that autisms, which used to be, I don't know the exact numbers, but maybe 1 in 100,000, and today they're like 1 in 1,000 or 1 in 500 or some crazy number. Maybe you know the numbers better than I do. But can multiple vaccinations in childhood cause autism? And if so, and if not, how many children's vaccines, is it safe to get at one time? And how far should they be spaced apart?
Wow, that's many questions.
Sorry.
Okay, so let me summarize the last 20 years. Well, so maybe in very big strokes. Yes, there are people who have strong opinions about vaccines. I found it most helpful to try and be as little opinionated as possible and just look at what can we learn from what we see. And to me, having the questions that the so-called anti-vaxxers have, if we want to stay with this dichotomy, then those are really important questions. And those are the questions that need to be taken extremely seriously and need to be tested. These are hypotheses that need to be verified. And we need the best and most rigorous science to address these questions and very valid concerns. We're immunizing children, we're immunizing healthy people in general. So before we do something to somebody healthy, we better follow our own, ethical guidance of first not doing harm. So that's very wise. Now, how many immunizations can you give? There are numbers out there. Actually, I don't think that any country gives like 20 vaccines at the same time, but there, during childhood in the US, when you look at the US immunization schedule, there are like probably 20, some odd 20 immunizations that kids get throughout. That's kind of jabs, counting jabs. But at a given time, typically it's 1 or 2 immunizations, and then those may be combined. So they may combine more than, they may combine antigens or protect against more than one illness. That's a possibility. But it's not like, one child is kind of in an acupuncture session of receiving 20 needles or something like that. That's not there. How many can we treat? How many can we accept? Well, it's about 10 to the 9th. Our immune system is amazing, like the whole planet that we're living on. The immune system can deal with 10 to the 9 antigens simultaneously. That, to me, that's too much. So in a vaccine, there's about 10 to the second now, if we're looking at the currently available marketed vaccines. So for the immune system, the immunizations are not a big deal in terms of, is it too much, And that's from day one of being born. So, and kind of an overwhelm isn't really there, and the body of evidence there is overwhelming. So I think that question has been addressed and clear. Yet it doesn't mean that there are individuals in the population that may actually not handle a given vaccine well, and so that's a whole different question. Yeah.
Okay, well, we're going to take a break, and then we'll talk about your book a little bit. So we'll be right back. Don't go away. Dave Nassaney, the Caregiver's Caregiver, has just released his 6th book entitled It's My Life Too, Thrive to Stay Alive as a Caregiver. It was specifically written for caregivers who know they should be putting their needs first, but just don't know how. Dave is the sole caregiver to his wife, Charlene, since 1996. He knows firsthand what caregivers are going through, because he is one. He now speaks all across the country, offering caregivers his amazing caregiver support package. Even the airlines tell us that in the event of an emergency, to put your oxygen mask on first, before you help your child with their mask. They know that those who don't heed their advice often black out, thus becoming unable to help either themselves or their child. And caregivers are exactly the same way. It's My Life Too, Thrive and Stay Alive as a Caregiver will help caregivers who are neglecting their sleep, diet, and social life and learn to put their needs first. Pick up your copy today or buy one for your special caregiver. On sale everywhere and at caregiverdave.com. And we're back on the Caregiver Dave Show. I'm Dave Nassaney with my guest, Dr. Yon Bon-hoffer, and we're talking about vaccines, infectious disease. Now we're talking about your new book, which is called Dare to Care, How to Survive and Thrive in Today's Medical World. What's this book about, and who should read it?
Thank you. I'm touched by a very similar subtitle to your book that has just come out. So, How to Survive and Thrive as a Caregiver and How to Survive and Thrive in the Medical World. This is really, given the current situation that we're in, this is so topical. So many caregivers and healthcare professionals are tired, exhausted, worn out, burnt out.
Caregivers too.
Yeah. Yeah. So, it's really exciting to have this conversation. So this book, the book Dare to Care, came about by it's basically letters to my my goddaughter. She's a young pediatrician now. She's a young resident in Germany.
Oh, I bet you're very proud.
And I was kind of looking at what can I give to her? What is meaningful here? And I felt, why not write up all of those things that I have learned during the last 25 years and that they didn't tell me in medical school and that I wish I had known back then. So that's what the book is about. It's lessons learned from my clinical life, from caring for people, where I failed, where I felt ashamed, where I learned, and where I was grateful for the lesson. And that's what I passed on. And that's what is now available in this book in terms of different letters to Hannah, my goddaughter.
Hannah. So is there a particular letter that that we need to hear? For example, just singling one out that would impact us emotionally? I may not be prepared to do that, but maybe there is. You would think about it, and
most of those stories. Each chapter has a story that has kind of changed the way I practice, and one of the probably most profound stories was that I worked in hospital as an attending as an infectious disease physician, and I was called to a 9-month-old baby, Jasmina. And
you remember the name? How flattering.
I'm allowed to tell her name. The family has allowed me to to say that, to share this story. And Jasmina had an illness that meant that her lifespan would be very short, probably not more than a year or two. And she had a respiratory tract infection, like many babies have every winter, called respiratory syncytial virus, RSV. So it's a cough and a cold, essentially, for most kids. And some need a bit of oxygen. But she had an illness that meant her muscles are not strong enough to cough.
Oh.
And it meant that she was unable to get rid of the phlegm, and that she was unable to actually go through the work of the baby to keep the breathing up. And so at some point it became clear in her journey that this would become really difficult for her. And so I was called to the room, and there was a lot of excitement in the room. The nurses were running around, and all sorts of things were happening, and it was very, very high frequency in the room. And so I went to the mother first and just took her hand and sat down with her next to the baby and just looked at her and said, "Wow, it's a lot right now, right?" She just bursted into tears and had the possibility to let go of her fear and of the stress for a moment. So we quietened down the room, and we said that all the nurses are okay to leave. And fast forward, we were breaking all the rules in the hospital. So we were bringing in an adult bed. She was wishing for that. I said, "What would you really like now? What would be important for you?" She said, "The baby cot is so small, and I'm used to be in my bed and have my baby with me, and I can't be with her right now. I'm distanced by these metal bars." And so I said, okay. I asked the nurse and said, "Can you please bring an adult bed?" But this is I said, "Just please, just bring an adult bed. Let's have it here." Okay. So actually they brought two. So we created this little space where both parents could be, where Jasmina could be, and we're bringing in candles, totally not allowed, bringing in scents, completely not part of the program. We were stopping a lot of monitoring, a lot of interventions, and it turned out to be that Jasmina was dying. She was actually leaving her body during that day. But there was healing, the process, very clearly tangible for the parents, that in the process of dying, there was a process of healing for the family. And I would include myself as being blessed to be part of a healing process. So I wasn't providing and doing anything to this family, but taking part in a healing process that was guided by the child.
That's an amazing story. And you're right. You were probably breaking all the rules, because it's not in the manual that you should do that. But heck with the manual, right?
Mm-hmm.
Yeah. In your opinion, what should we doing? What should we be doing to help support our healthcare workers through the pandemic and beyond? As you said, many of them are burned out, and maybe the rule book doesn't provide for helping them in ways that they need help. So you just gave a great example of helping a patient. Are there similar stories that we could be changing things or breaking some rules to be helping some of the healthcare workers?
Yeah, absolutely. We are trained to give the best. We're trained to deliver gold standard. We're kind of conditioned to never be good enough. And again, there's fear of doing something wrong. There's fear of harming. And I guess everybody caring for somebody else knows this. Everybody knows the fear, and everybody knows the doubt. Am I really doing the right thing here? Yes, nourishing the healer, putting the oxygen mask on first, is absolutely critical. It is not a luxury, it's a necessity. And nobody is trained in this. It's the other way around. In a healthcare system that is increasingly driven by lawyers and economists rather than caregivers and healthcare professionals, the lemon is being squeezed increasingly. And it is about time that we are reclaiming sovereignty, not as a power game, but actually sovereignty of the heart. And that is a systemic change that is needed, yet we're only going to be credible in this. And if this is not to be a political power game of professional organizations, we have to walk our talk. And that means to actually start with practices ourselves and to kind of discipline ourselves to nourish us as a healer, to replenish our batteries. And there's so many amazing tools available, techniques available for thousands of years that we could easily just learn from other domains and integrate in our process as part of being more professional than before.
I think you should be called Dr. Love because you are the doctor of love. Many people have unconsciously infected themselves with fear and anxiety by dooms scrolling, your word, during the pandemic. Why are negative emotions so contagious? And how can people guard against being overcome by them? And then you talk about non-love, that it's a disease also, and it can be passed from person to person, that medical professionals are often the carriers of this condition. Explain all that.
Yeah, it's the much bigger pandemic than COVID is fear. And if you like, the virus, the agent that we're transmitting from one to another, is non-love. And we have all been trained in this, and I'm including myself in this, and I guess everybody being humble about their own mistakes and failures and forgetfulness we're training ourselves in acts of non-love. And
you define that as failing to give a quick definition again, mistakes and
it's forgetting that we are caring for a shared expression of life.
Getting our oath.
Yeah, we are alive and we are caring for life, and we haven't created this and we're not mastering this. We are guests. We're privileged to share a journey together, and the arrogance that the medical profession is exerting to a ridiculous degree is I don't know. I don't have a word for it. It's shameful.
Arrogant.
It's arrogant, and it's about time that we're learning humbleness, and we're learning that humbleness is a strength and a virtue rather than a weakness. We are trained to always know that the patient has the problem, and as the caregivers, as the professionals, we have the solution, and that's our job to provide the solution. In my experience, the longer I'm in this profession, I feel that basically, like close to almost, the patient knows much better what they're actually needing on their journey than I do. And I'm really well advised to listen longer and more carefully to what the intuitive direction is. And then once I really get that, then I may bring in my 5 cents of, actually I happen to know and have an idea about how this could be accomplished,
Wow.
That's not the way that we're trained, and that's where the love comes in, is we really have a genuine interest in the person in front of us and in their healing journey, or are we more busy with our own needs and making a diagnosis quickly and turning over to the next patient rapidly and making diagnosis very quickly and priding ourselves in doing so? There's a lot to learn, I think, for us to grow to a next level of practicing medicine again.
Yeah. Why is compassionate listening, as you like to put those two words together, an important part of the healthcare process, but is often overlooked? And it's not even a skill for most healthcare workers. They're just, I don't know. What is the training? Or maybe they just forgot their training. I can't imagine them not being trained to do all these things that we're talking about. Is it that they were never trained, or is it because they were trained and forgot? Or is it because they're just too dang busy? The system is too overwhelmed. What's your opinion?
I can't speak for everybody, and probably it's different in different places on the planet, but to the many thousands of colleagues that I talked, it's generally not being trained unless you were fortunate enough to have a role model, a mentor in your career. And there are many amazing mentors out there who are actually training and teaching that, but it's not part of the systematic, it's not part of the syllabus to train and teach. It's the contrary. What we're trained and taught in is strategic conversation, it's strategic questioning, it's strategic listening. It's basically when I talk to a patient as a healthcare professional, the way it's defined today is that then I need to ask the questions in a way that I'm going down my differential diagnostic algorithm to arrive at a diagnosis and label, then I know the treatment, and then I'm fine and I can move on. So my needs are met, and I hope that some of your needs are also met. That's very different to actually compassionate listening, which is non-strategic. And then this is the magic that happens, is then suddenly the patient is telling this story is completely changes. There's a completely different story that is being delivered, and that changes the entire direction of the healing process. So as physicians, by strategic listening, we're actually undermining the healing process of the patient. Crazy.
It's true. And it sounds to me like you're describing Dr. Patch Adams, if you know who he is. Robin Williams did a whole movie about him. And I was actually supposed to speak on stage with him at the CNN Center this last year, but pandemic caused him to not be able to make it. I was so disappointed. But is that true? I mean, is Dr. Patch Adams one of your models that you're trying to emulate and duplicate?
I wouldn't put it like this, but I have deep respect for him. He's an incredibly colorful person, and I had the opportunity to actually meet with him. He came to our first Congress in San Francisco, and he spoke there, and we had some time to talk, and we had lots of opportunity to share thereafter. And I'm still hoping that after COVID, it will be possible to have him come to Switzerland.
Yeah, me too.
Yeah. He's a wonderful being and such a pure, wonderful heart, with a colorful personality, and it's an amazing person. I have deep respect for him.
So obviously he was trained correctly, or was he not? Did he just throw the book away and came up with his own book?
Well, I mean, as it could be seen in the movie, is that he understood what a healing process is before he went into medical school. He's seen the dark side of life. He's seen the lonely, dark rooms, and he has experienced suffering, and he's also understood what it is that fundamentally helps us to deal with suffering, and that whatever medicine has to provide doesn't really touch the suffering at the root. It touches the signs and symptoms of it, but it doesn't really get to the root cause of it. And he saw that humor is one of the ways to deal with this, and deep listening is one of the ways to really go deeper than the signs and symptoms of illness, and that relieving the pain of a fracture can be a blessing for those who have the pain of a fracture, but it doesn't really get to the suffering. And that's becoming a human in the midst of being a professionally trained person. And that's what we're lacking so often. Well, none of my colleagues is lacking being a human, but we're not having the courage to allow us to be that. There's this idea of professional distance that is in the way.
So it takes courage. Courage against ridicule from your peers, courage against pushback, political courage.
Yeah. This was wonderful to see with the book Dare to Care. I was really fearful. I was really nervous about the book when it came out. I was like, whoa, this is like, I'm really going to be marginalized, going to be ridiculed.
Well, especially during this time. I don't know how long you were writing it for, but it's like, okay, it's coming out. Now this is the environment it's coming out in. It's like a big target on your back. Yes.
Yeah.
So how is that working out for you, Doctor?
Well, it's been. I was actually crying when I received the first endorsements. I was actually crying that I felt, wow, actually, it is received well. It is actually
who endorsed you.
Yeah. Sorry?
Tell us who endorsed you.
Well, I was sending the book to several colleagues that I really wanted to hear their opinion of, and I was really touched that Peter Sullivan, a professor at Oxford, who was one of my mentors as a student and young resident, has been really he has set a lot of, he was really important to setting the path in my professional development, and I kind of came back to him 20 years later, and with this, and so this is what happens 20 years later to one of your students, and he wrote a really beautiful endorsement, and James Doty from Stanford has written, and I highly respect James Doty, and there's a number of colleagues, Michael Gold from Australia, so several kind of, if you like, colleagues at other universities, training centers, medical schools, who have really valued this and felt this is an important direction for us to take and to give more emphasis. And that was really encouraging for me.
Wow, that's awesome. What can patients do to assure that they get the attention that they need if they're not getting it? What do you recommend they do? Scream and yell, kick and, or are there better ways?
I feel that there's a tremendous opportunity to empower patients in requesting the care that they're deserving. And I feel as healthcare professionals, we are not stepping up in the best, in the best version of ourselves by being so-called professionals. And I feel I would really like to encourage patients to request to being heard rather than to being treated. The most powerful way that I know as a physician is that when a patient is really looking into my eyes and pointing out that I'm stressed right now and that I'm not really giving them the attention that they deserve, that's what really touches me.
Wow.
So complaints, screaming, yelling, I have learned, as hard as it sounds and as shameful as it is to say that, but I have learned to kind of create a bit of a protection shield, that if somebody's yelling and screaming at me, then I'm kind of taking that professional distance and like, okay, so I hear that you're angry, and then we're going into this conversation type stuff.
Well, I know you're different and you're unusual, and how would you recommend that patients react if they're not being treated the way they want to be treated to someone other than yourself who maybe doesn't have your gifts of understanding and compassion, etc.? Someone who's less likely to hear them.
I have trust that every human being is available as a human being, as stressed as they are. I haven't met a single colleague who's not a human being. And sometimes it needs a bit of a wake-up call. And I find myself so often in situations where I didn't show up understandable and compassionate, but I was actually stressed out and I kind of lost my track. And I was quite full of myself and arrogant and felt like I need to manage the patients on the ward now and all sorts of things. So who is to blame, you know? This is so easy to step into this trap.
It could happen to you. It could happen to anybody, right?
As a patient, if we're connecting to our hearts, we're taking a deep breath and we're recognizing I'm not being treated in the way that I need. This doesn't feel right. Something is off. I would encourage to anyone, whether healthcare professional or patient, deep breath, to actually anchor ourselves in our heart.
Yeah.
And to speak from there. The language of the heart is always heard. It may only be kind of heard at night when the healthcare professional goes to sleep and is reviewing the day. It will be heard, and it will be one tiny step towards bringing more heart into healthcare.
Well, in the last couple of minutes of our show, I understand you founded a Heart-Based Medicine, a nonprofit foundation and global network of healthcare professionals that's gathering data and bringing together experts on the impact of love on health. What do you hope to achieve through this effort?
I would love to see a transformation of the current healthcare system as it is. And I feel that this is... I had this crazy vision. So I worked with the World Health Organization as an infectious disease specialist and advising global health programs. And I felt, wow, if I can do this, maybe I learned something. And maybe we can actually... And this was a bottom-up approach. So we started with a few physicians actually getting together and saying we need to change the way we deal with vaccine safety. And it has changed the way that this is now happening. So maybe we can do the same by bringing more heart into healthcare. And this is a bottom-up approach. So one heart at a time, one physician at a time. And this is what heart-based medicine is about, to create a network of caregivers and healthcare professionals, everybody who knows about the value of care, and learn from each other and co-create a medicine where the heart is really at the center and love is the fundamental healing source that isn't really recognized in the way that it could be, I feel.
That's awesome. So how can someone get a hold of you or buy your book or answer any questions?
There's a website, heartbasedmedicine.org, and there are all the contact possibilities. There are, I'm trying to learn about social media. So I'm trying to find my ways here. This is a very new world for me, but those should be channels too. So there's email. So all of those contact points are available. And I would love to be in interaction and create that field of people who care deeply about changing and transforming our medicine in a way that we'd like to see it. So there's a big welcome and invitation to join and co-create a different kind of medicine that I hope serves our next generation of children.
Well, you were an amazing guest. I thank you so much for coming on and answering questions in an honest and compassionate and transparent way. That's unusual, and we appreciate it. And thank you to all the listeners who show up every single week, week after week. And just a reminder to go to caregiverdave.com, our website for caregivers to help you not just survive, but to thrive caregiving. And we have 3 free gifts for everyone who will just register. It's free. Just give us your email, and you'll get these gifts, and they will help you a lot. One is are you a candidate for burnout quiz? Another one is a copy of my first book in ebook form. And the other is this audio to help you sleep and stay asleep. So great gifts. Thank you again for everyone tuning in, and thank you, Doctor, and I just appreciate you so much. It was a great show. And we'll see you next time. Bye-bye.
Thank you, Dave. Thanks a lot. Great honor. Fantastic. Thanks.
Sometimes it feels like the sun will never rise, like the birds will never sing.